So I started this clinic for the same reason that I went to medical school and the same reason that I chose to become a doctor. And that's so that I can help people to make healthier decisions, healthier lifestyle choices, and at the end of the day, attempt to reduce the risk of modern treatments. And a key part of that risk reduction is education. And as you all know, education takes time, and it really does take time for me to impart the knowledge that I've gained into my patients in order to help them reduce their risk. And a recent example of that is a 63-year-old female that came to me and became a member of this clinic after having diabetes for a long time. And she was without medication for 3 years because she was unable to, unfortunately, afford insurance. And so in that first visit, we spent an hour and a half together. We took the time that it took to explain diabetes to her, to explain what was going on with her body at that time, the dysregulation of insulin as related to blood glucose. And she said that no one ever explained that to her before, and that really is a big help for a person, is to understand what's going on with their body so they can understand why they're implementing these changes. I had asked her to take pictures of the food that she ate and the things that she drank for 3 days before she came into the office. And so she brought those pictures with her. And we went over those things together, and we talked about why she would want to eat more of particular foods and less of others. Basically, I had asked her to stay away from white foods. And so this is an issue of glycemic index. And so during that time, I discussed with her and explained to her what a high glycemic index food versus a low glycemic index food is, so that she can understand why she needs to choose one food versus another, and why she's going to be leaving out a whole lot more carbohydrates than she had in the past. In addition to that, we had discussed, basically taking away all calories from drink, because these are some of the easiest calories to get rid of, and something that could help her in the future to hopefully use or require less medication. At the same time, we were able to discuss plans for exercise, and she really hadn't been exercising all that much. I talked to her about how exercise reduces the requirement for insulin by more efficiently using the glucose or the blood glucose that's in the bloodstream. And we took the time to explain to her on a step-by-step basis how she needs to implement an exercise program. That's going to start by me making sure that she's safe to do that from a cardiovascular standpoint. And then she's also going to maybe 5 or 6 days a week spend 30 to 45 minutes exercising to the point where she's sweating profusely. If she were to be walking with her friend, she wouldn't hopefully be able to hold a conversation with that friend because she's going to be exercising that hard. And there are a lot of people out there that just don't understand that that's how hard that you need to exercise. Gardening is not enough. Doing housework is not enough in order to reduce the amount of blood sugar that you have in order to help yourself with diabetes, so that hopefully you can use fewer medications. At the same time, we went over all of her labs. I explained to her what each of them meant. We talked about the medications that she would be starting, the risks and the benefits of each, what each medication would be used for, and how it's going to help reduce the risk for particular things. Going anywhere from metformin to insulin that she'll be taking, talking about lisinopril, how it helps with cardiovascular, how it helps with high blood pressure and heart issues as well. We had talked about statin drugs and why that's indicated for persons that have diabetes, and aspirin as well. When you compare this type of visit to an insurance-based practice and what would happen in the same situation, well, she likely would have had to wait a whole lot longer than she did here to get that first appointment. In that first appointment, the primary care doctor would really only have about 10 to 15 minutes to see her. In that time, there's just not enough time to educate a person on what is diabetes, what are all these medications for, what are all the risks of the medications, how should you change your diet, how should you change your exercise regimen. And so what happens is, unfortunately, that doctor basically has to farm all of that education out. And so you would be sent over to an endocrinologist, you would be sent to a diabetic educator, and I think, as you know, it'd probably take you 3 or 4 more weeks to get in with each of those physicians, or the doctor and the diabetes educator. The diabetes educator is really going to talk to you about the American Diabetes Association guidelines, which is the triangle that we all know so well. That's carbohydrate based, and over the past 30 years, we finally figured out that that may not be the best way for diabetics to eat. When you go to see the endocrinologist, unfortunately, that doctor is under the same time pressure as the primary care doctor. And so you're likely to spend about 10 to 15 minutes with that doctor as well, and they're going to discuss your medications with you, as opposed to really explaining the details of what diabetes is, how it affects your body, and how you need to change your life so that you require fewer medications. At the same time, if you have trouble implementing the diet, if you have trouble changing your exercise regimen, maybe you're not as motivated as you would like, in that model, you're going to have a really tough time getting back in with your doctor, communicating with your doctor outside of the clinic. So anything other than face-to-face is going to be troublesome. You're not going to be able to text with them likely. I think you'll have a hard time communicating effectively by email with that doctor. And in our clinic, we're able to do those things. I'm going to take you by the hand. I'm going to walk you step by step through all the changes that you're going to make. And along the way, I'm going to be there to help you, to guide you, either in the clinic, on the phone, by email, by text, or by webcam visits. And if you have a problem, you're going to be able to get in touch with me so that I can help you get past that bump. And it's, it's kind of like maybe that favorite teacher, that favorite coach that you had back in high school or college, where, on your own, you weren't able to learn all of the things that you wanted to learn, but with their guidance and their concern and their knowledge, they were able to help get you to the place where you wanted to be.